3D animation, motion design, live action, or AI generation. These are just some of the ways to create a video. In this episode, I will tell you how to choose the right format for your medical video. I will show you specific solutions using real examples. My name is Sergey Rodin. I am the founder of the video marketing agency Lava Media. We specialize in creating and promoting video content. We have worked with medical brands like 3M, AcuCheck, Fresenius Kabi, and many others. Before picking a format, let's look at three key questions. Who is the video for? Investors, doctors, or patients? What is the main message? Is it about technology, the effect of a medicine, or just brand positioning? Where will you show it? On a website, a big screen at a conference, or as an ad on social media? Next, look for examples you like. Usually an agency will find examples for you, but maybe you know a competitor with a video you like. If you have a reference, tell the agency exactly what you like about it. For example, when we made a mood board for a client recently, we used two main references. The first one showed the vibe, a monochrome blue background and a product with a glossy, clean look. By showing this, we told the client we want a specific lighting and style. Without clear limits, it's easy to get confused. For the same project, we use a second, more complex example. It showed an exploded view, the device coming apart to show the small internal details. Even though the final result was different, this was a great starting point for our discussion.
Fluidics, a tubeless insulin pump that will reduce the stress and burden of managing diabetes. Panda features a non-mechanical pump and valve system that automatically delivers microdoses of basal insulin around the clock.
The most common question is, should we shoot a live action video or use graphics and AI? Here's how to decide. Factor number one, budget. If your budget is under $7,000, graphics, stock footage, or AI will give you the best quality for your money. If your budget is higher, you can consider a real film shoot. Factor number two, content. Sometimes you must film because of the story. For example, in our 3M project, it was vital to connect the product with the reputation of a famous dentist. You cannot solve that marketing task with just stock footage or AI. You need the real person. There is a link to that full case study in the description. Another reason to film is trust. When we made a video for stroke patients, we needed to show a real doctor. Expert advice from a real person is more valuable to the viewer. For that video, we didn't use many graphics. Instead, we used color-coded props. Red objects meant remove this from house, and blue objects meant keep this. If you work with video content often, please subscribe to my channel. I talk about video marketing here. Should you use AI generation? Usually when people ask about AI, they want to replace stock footage or make graphics cheaper. I only recommend replacing stock footage with AI if you can find what you need. For example, if you need a very specific medical lab or a super expensive machine in the background that isn't on any stock site. But if your story is about generic patients or doctors in a standard clinic, use stock footage. AI makes the process more complicated in this case. For example, we recently planned to integrate a medical device onto a patient's shoulder. We thought about using AI to generate the scene, but it was actually easy to use a stock video, build a 3D model of the device, and track it onto the actor's shoulder. You can read that case study in the description. One more warning about AI. I don't recommend it if the video will be shown on a giant screens in airport or malls. Airbags and glitches are very easy to see on a big screen, even if they look fine on a phone. Should you choose 3D or AI? If you want to show how a device looks, how it works, or what is inside, choose 3D. AI gives you very little control. In 3D, if you want to change a part from metal to plastic, a designer can do it in 15 seconds. And AI will take 3 minutes to think, and it might change their own part or hallucinate. However, if you are making a video about cloud data storage for a hospital, the exact material of the machines doesn't matter. In that case, AI is great. You can generate scenes of different hospital rooms and use graphics to show the data moving. Don't get me wrong, I am not against AI. I believe in using the best tool for the best result within your budget. For example, if AcuCheck came to me today with the same project we did years ago, I would suggest doing it all with AI. The presenter wasn't a real doctor, so we could use AI avatar. We didn't need a specific location, so we could build a virtual set. We could even animate the device from just a few photos, with no filming required. Or we could use a hybrid approach, use AI for the shots of the device on the model, but film live action close-ups of the screen to show the complex data and numbers perfectly. Choosing a format for a medical startup is not about being trendy. It is about picking the right tool for the job. Need to show every detail of a device? Use 3D. Need a fast, cheap hospital atmosphere? Use stock footage. Need a virtual assistant or unique background? Use AI. Need trust and authority? Use a real doctor and a real shoot. If you need help picking the right format for your medical project, write to us at Lava Media. We'll study your task, find the right references, and help you create a video that both doctors and investors will understand. All links and our contact info are in the description. Subscribe, hit the like button, and let's make great video marketing. See you in the next one.